Hello, my name is Laimonas Siupsinskas. I'm the physio of the Nord Clinic. Today I wanted to show you some exercises which you can do at home before coming for the hip replacement surgery. These exercises are called Prehab exercises. That means that you can try to prepare your body for the hip replacement for the better outcome after the surgery. What you can get before coming here, I would strongly recommend you to have the stationary bicycle at home. So this stationary bicycle can be used for the exercising when you will come back home after the surgery. Also, I would like to get some elastic resistance bands, which are also very useful during the exercises after the surgery. But before the surgery, you can do some of the exercises to strengthening the muscles and to gain the mobility in the hip and in the other areas. Okay, most of the exercises which you can do to strengthening the muscles around the hip, which you will need later on for the rehab, you can do in lying position. So we understand that the main problem you are coming for the surgery is the pain and the restricted range of motion. So in that case, all the exercises which I will show you should be done without any pain and as much as you can. So that means that you shouldn't be pushing too much to avoid pain and do not aggravate any symptoms. So try to get these exercises in pain-free range of motion. So first exercise, you can lay down on your back, bend the knees as much as you can, and the exercise will be slight pelvis lifts. Yes, the idea is that you need to contract your glutes and lift up as high as you can, hold for a while, and put it down. If you are advanced patient or this exercise is too easy for you, you can do an alternative way. You can do lift by using two legs, then you can lift up by one leg and alternate the legs doing the exercise like this. The third option is lift up the pelvis and lift up one leg and another in alternative way. Okay, the next exercise is lifting one leg and another by alternating the leg lifts like this. So lifting up one leg, lifting another leg. Okay, another exercise is for the muscles in front of the thigh. It's called quadricep muscle, and it's very important to have the good muscle strength before coming to the surgery, because later on after the surgery this muscle will play an important role in walking and exercising. So you can roll a towel, put it under your knee. The knee should be stable and you are lifting up the foot up and down by contracting the muscle in front. Yes, up and down, up and down. So the most important part is try to squeeze the muscle and to lift up the foot and put it down. The other exercise which you can do, also staying in the bed, is side sliding. So that means that you are keeping the leg straight. Let's imagine that this is the bad leg had the surgery. Sliding away from the midline as much as you can, as much as your hip is letting to do that, and coming back. Sliding away and coming back. Sliding away and coming back. Okay, the exercise for the muscles and the glutes is the squat. So you're supposed to holding somewhere where it's safe and stable. So legs should be in the width of the pelvis, holding here and doing very small squat, putting your pelvis a little bit backwards. So like this, yes. You don't need to go very deep. It's enough just to go up and down. The last exercise is hip extension. That means that you're supposed to holding somewhere where it's stable. Let's imagine that this leg is the leg which is gonna have the surgery. Put the leg backwards, stretch a little bit the front and come back. And do the half of the step backwards, stretch and come again backwards. So I have showed the exercises which we advise to do once a day. And minimum 1 month before the surgery. So we know that the best result can be reached when we are doing the exercises in about 1 month before the surgery. So it will improve your outcomes after the surgery. You will get better faster. So one time per day for the whole month. And of course, you can do 1 day off in a week if you feel some pain or some tiredness in the area which is affected by the exercises. If you will feel any soft tissue problems around the hip or down the hip, so icing would be also the good solution to relieve the pain if you did too much of exercises. So next day you have to skip, take some rest, and come back to the exercises, maybe with a lower amount of exercises or lower number of repetitions.